Friday, Dr. Dodge, Alethea Integrated Medical. So wishing you a great start to the weekend. Last week we talked about when is a good time to exercise, some basics on that, but a little deeper dive this time. And this is maybe more for when you're back at your home base, where either that's your home, like mine, or perhaps in a gym. You know, lots of good ones around the area we're in, Lincoln. And it doesn't have to be anything fancy. In fact, my kids kind of make fun of this one. They said it doesn't have the vibe they like. It doesn't have all the machines. I'll point that out to them and say, well, all you really need, as we shared last week, is your body. Your own body weight does a great job of giving you enough resistance. And especially if you're trying to lose that weight, the cool part about that is you're adding a lot of resistance that way. And as you begin to maybe get healthier, maybe shed a couple of those pounds, hey, guess what's you're building underneath? It's muscle. That is one thing that a lot of times patients will share is they don't feel, after losing weight, they don't feel as big or strong. Well, that can happen if you're not actively engaging those muscles with some resistance. So one of my favorite overall exercises, and again, if you haven't done this before, you might want to really use some resources like look for a trainer in the gymnasium, a friend that's been doing that for a while. So what I'm showing you is just a demonstration, not necessarily advice on exactly how to do it, because again, every repetition is an opportunity for form improvement. So I just do a basic squat, and we showed you with body weight last time. So I use a bar, and I go down, and I go up. So you might notice I wear these knee sleeves, and that they're not a medical device, but they're just more, frankly, I think, for mental assistance. They make my knees feel better, so I use them. So a squat lift like that engages almost every body muscle that you have, you know, minus a few of the lesser ones, all right? What I do like about these machines that you can use them at your own pace. You can use a bike, you can use a treadmill, and for me, that can look as hard as you want it to. You can ride low resistance, long, easy, slow, and I recommend that for illness recovery. Whatever viral illness you might be recovering from, long, light exercise, and if you can do it outdoors, maybe even better. But if not, long, slow, and on a routine basis. So, same with treadmill, walk at your own pace. I'm kind of a sucker. I watch TV when I do mine, but that's my guilty pleasure. So I feel like, hey, if I'm going to watch TV, I'd rather do it on the treadmill than sit on the couch. It serves my health a bit better. So again, you don't need a lot of fancy equipment, but you just need to do something. And what I would suggest is find a program online or with a professional that lets you kind of go up a ladder in maybe it's repetition or weight, just so you can measure your progress. It gives you a carrot or 2 or 3 or 10 to chase and really engages your mind and body in the activity that you're doing. So I'll keep pointing out some more tips as we go along, but until then, have a great weekend, everybody.